Health officials state that the high density of mosquitoes according to the Brito index has been recorded from Sri Lanka. According to experts, this represents an epidemic.
Experts suggest that if the Brito index, which measures the density of mosquitoes in a certain area, shows a value higher than 15 units, that can be considered as a high epidemic level. The value in the Brito index in certain parts of the country is between 30 and 35.
Entomology studies confirm that the Brito index is gradually increasing. The amount of containers and canisters that were left after the floods were very high. Since these containers were filled with water, the Brito index increased exponentially. As a result, dengue is on the rise again. There have been 20,000 cases reported as a result, and more than 31 deaths have also been reported.
The Health Entomology Science Officers Association says that steps have been taken to deploy teams to areas with a high density of mosquitoes to inspect them. Fumigation was done in a number of areas that come under the purview of the Colombo Municipal Council.
They carry out fumigations. The other people are also just following them. This will not be a solution. Take a look at that canal. Who will look into this? The individuals buy and leave these lands. The people living in the vicinity dump the garbage in that land. That is the reason for the mosquitoes to breed. 6 children succumb to dengue on our street. There are another 6 in the hospital.
The Ministry of Health says that 60 teams have been deployed to fumigate the areas where a high number of dengue patients have been reported. The health authorities remind the public to seek medical attention if fever persists for more than 2 days.
The symptoms are similar to the symptoms of viral fever. Fever, headaches and bodily aches are the common symptoms. If the fever persists for more than 2 days, it is important to obtain a full blood count test on the 3rd day. After showing the report to the doctor, it is important to get hospitalized if needed. On rare occasions, there could be a condition where this is internal hemorrhaging or excretion of plasma. If such symptoms are seen at home, that person should be hospitalized. If a person is weak, if a person is sleepy, and if the person has a stomachache or increase in pulse and reduction in the passing of urine, that person should be hospitalized immediately.
Newsfirst also made inquiries from the Minister of Provincial Councils and Local Government.
The Ministry of Provincial Councils and Local Government is extending its fullest support to the National Dengue Eradication Program. We have also instructed all local councils to coordinate resources and labour to ensure the success of this program and to ensure its progress. We have seen an increase in dengue mosquitoes breeding grounds at construction sites and neglect of steps to be taken to prevent dengue. I have instructed all local councils to cease plans for such constructions if there is such a situation and to move towards the goal of eradicating dengue.